If a person goes home with supplemental oxygen, will they always need to be on oxygen therapy?
That's a great question to ask. Many patients worry about starting on oxygen because they're wondering if this is something that's a permanent thing that I need oxygen. So in summary, I will say that that the most common setting in which people get started on oxygen is when they're recovering from a COPD exacerbation, typically a severe enough exacerbation that they needed to be in the hospital. And you and your doctor will make a decision about whether you need to go home on oxygen based on the amount of oxygen in your blood. I would say in about 50% of the cases, based on studies that we've done and other people have done, that you may be able to come off of oxygen within the first 30 days, perhaps 60 days, perhaps 90 days. But in about 50% of the patients don't need oxygen beyond the first 90 days. It's hard to predict whether or not you yourself will need oxygen beyond 90 days. And so the best way to do this is really to have your oxygen level tested periodically after you go home at your doctor's office, or if you have a visiting nurse coming to your home or a respiratory therapist, to have those measurements made and talk with your doctor or other healthcare providers as a team, whether you need to continue oxygen or not.